So I'd like to begin by introducing our speakers. We're going to start with Marschall Runge, who is the CEO of Michigan Medicine, Dean of the U of M Medical School, and Executive Vice President for Medical Affairs at the University of Michigan. Dr. David Miller, who is President of University of Michigan Health. Nancy May, who is our Chief Nurse Executive for U of M Health. And Dr. John Carethers, who is Chair of the Department of Internal Medicine at U of M Health. So I'd like to begin by turning this over to Dr. Runge.
Thank you, Mary, and thank all of you for joining us today. We greatly appreciate your efforts to get these important messages that we'll communicate to you out to the public. I'll just start with the bottom line. The bottom line is COVID-19 is not only life-threatening for those who have COVID-19. The surge of COVID-19 is putting others at risk by keeping us from delivering life-saving care. People are dying at home all across the state and across the nation and at Michigan Medicine because our hospitals are full. And we need the public's health to fight COVID-19 for all of us. It's a dire situation across the state right now. The state of Michigan reached a record high of hospitalized COVID-19 patients this week, the highest number since the very beginning of the pandemic, now more than a year and a half ago. On Monday of this week, Michigan Medicine had 112 total COVID-19 admissions of adults and children. And this morning, there are 110 patients with COVID-19 or suspected COVID-19 in our hospitals, many of those in ICUs and some requiring mechanical ventilation. We'll put up a graphic, and as you'll be able to see in this graphic, the overwhelming majority of hospitalized COVID-19 patients are unvaccinated. This graphic is available for you if you'd like it after our presentation. What I'd like to point to is on the right side of that slide, none of the patients on ventilators have been vaccinated. Now, getting back to my original message, people have died and will die of non-COVID-19 disease in our area, across the state, and across the nation because COVID-19 is overrunning hospitals. Earlier this year, the CDC, the Centers for Disease Control and Prevention, reported that nearly 3.4 million Americans died in 2020, which was an all-time record. And of these deaths, these patient deaths, more than 345,000 were directly attributed to COVID-19. I'm a cardiologist, so let me speak to the increase in heart disease and death rate. For many years, with improved technology, improved medications, improved care, the numbers of Americans who die each year of heart disease has been decreasing. But that was not the case in 2020. By the end of the year, the death rate for heart disease had increased more than 3% over the prior year. What this means is that 32,000 more people died of heart disease in 2020 than in 2019. And this was really only the second time in 20 years that there was anything but a decrease in deaths from heart rate. The major reason, or at least a major reason, that's thought to be responsible for this increased death rate from heart disease is that people didn't want to seek treatment in the emergency rooms or in the hospitals because they feared getting infected with the COVID-19 virus. This is why it is critical, really critical, for patients who need emergency care to seek out the closest emergency room. And our hospitals must have the room to accommodate them. And it's not just the excess rate of death from heart disease. The COVID-19 surge that is going on now has forced us to reduce, for example, surgical volume across the state, across the nation. And patients who don't receive timely surgery are dying, and even more, many more patients who've rearranged their lives to accommodate very much needed urgent surgery. When that's canceled, it's not only disappointing or inconvenient, it's traumatic. And many of these individuals get sicker. So far, the Delta variant is responsible for all the cases in Michigan. Not a lot is known about the Omicron variant, except that it may be very fast spreading. The teams at Michigan Medicine are concerned. We're anxious about increasing cases with holiday gatherings coming up, particularly if unvaccinated individuals are attending. And one of the simplest things you can do to minimize risk is to wear a mask, even if you're vaccinated. So let me close my comments by saying, first and foremost, vaccination is the only way out of this pandemic. And the unvaccinated are not just risking your own lives or those of your loved ones from COVID-19. You're risking the lives of others who may die of preventable diseases, who can't get their needed health care. At this point, I'd like to turn it over to Dr. David Miller, who can give us some more details about the current status of Michigan Medicine's health system. Dr. Miller.
Thank you, Dr. Runge. Good morning. I'm going to repeat a number of the key points shared by Dr. Runge during his presentation because I think they're very important and they're relevant both to us here at Michigan Medicine and across the state, the nation, and the world. Like other hospitals and health systems across the state, Michigan Medicine is now experiencing one of its highest surges of COVID-19 patients, while also continuing to take care of many patients with cancer, cardiovascular disease, and other life-threatening conditions. It is a reality that the overwhelming majority of COVID-19 patients that are hospitalized currently are not vaccinated. It is also true, as illustrated in the figure shared by Dr. Runge, that none of our patients with COVID-19 on ventilators have been vaccinated. Right now at Michigan Medicine, our hospitals and clinics are busier than ever, and our teams are working tirelessly and courageously every single day to provide the safest and highest quality care for our patients, and to also care for each other after nearly 2 years of managing this pandemic. Even with these extraordinary efforts, however, staffing shortages are also impacting access. For example, here at Michigan Medicine, we've had to close several much needed beds in some of our critical care units. And fewer appointments are now available for patients eligible to receive monoclonal antibody treatments that can reduce hospitalizations and death for some patients with COVID-19. As Dr. Runge mentioned, the current circumstances have consequences. At Michigan Medicine, we are continuing to cancel surgeries because we just don't have the beds. This week alone, we've canceled more than 40 cases. These are heartbreaking decisions that have significant health impact for the patients and significant consequences for the families who are also affected by these cancellations. As a major referral center in the state of Michigan, our current capacity constraints also mean that Michigan Medicine is not able to accept transfers for patients with highly complex conditions in hospitals around the state. Our emergency department is overflowing and patients are waiting for beds at all of our hospitals. This is not how we or anyone wants to provide or receive health care. We need your partnership now to address and reverse this situation. I'd ask everyone who's unvaccinated to please get your first dose. The vaccine may not just save your life, but also the lives of others, including our friends, family, neighbors, colleagues who are experiencing delays in the receipt of necessary care. If you are already vaccinated, get a booster dose. We're also asking everyone to carefully consider the need for care in the emergency department so we can ensure access for very sick patients in need of immediate care. Although our emergency department is crowded, please don't stay home if you have an emergency. Come to the hospital to get emergency care if you have symptoms like chest or abdominal pain, stroke symptoms, or trouble breathing, or if you believe that your life, limb, or body function is at serious risk. We are here to take care of you. However, for more routine care, please consider other options if they're available to you. Call your doctor, schedule a virtual visit, go to an urgent care center, or even send a message through your online portal if this is an available option. It's also critically important to again recognize our extraordinary healthcare teams. Despite the incredibly challenging circumstances, our dedicated teams are coming together every single day and doing everything they can to preserve access and ensure safe patient care. This work is truly heroic, but our teams are tired, if not exhausted, and we need your help, the public's help right now to end this pandemic. I'd now like to introduce Nancy May, Chief Nursing Executive for University of Michigan Health, who will talk more about the effects of the pandemic on our staff.
Thank you, Dr. Miller. The pandemic has truly had an effect on all of our care teams. And I would like to say that I have the privilege of working with many of our nurses that have stood up, shown up, and done the right thing every day as they've come in to serve our patients and our families. Nurses are crucial to our healthcare delivery, not only here, but globally. And our nurses across the world are really feeling the brunt of the pandemic, and in Michigan, this latest surge. It has been 20 months of unrelentless fighting this pandemic, and our care team members are weary and feeling the exhaustion. Nurses and other care team feel frustrated when we know that vaccines are available, yet many have selected not to get vaccinated. Then we later see these patients coming into our doors that end up in our ICUs and on ventilators. And this is all preventable. It is a national trend that healthcare professionals, including nursing, are leaving the profession because of the pandemic. The compassion fatigue that they feel day in and day out as they come through our doors, and the moral distress of caring for our patients is taking a toll on all of the team members. They are tired and they are stressed out. Our teams at Health are dedicated, compassionate caregivers who stand up and show up every single day to work, often working double shifts and picking up extra time to fill gaps in staffing. It is the right thing to do for our patients and our families, and our teams feel such purpose to the work and the care that they provide. The connections that nurses have to purpose for the work is felt throughout the organization. We are so very grateful to all of our nurses and all of our care team members. This isn't, there is not really any Michigan Medicine employee that hasn't been impacted by the pandemic in one way or another, and they've all shown up and stood up every day to help out in any way that they can. There are not enough words to express my gratitude for these dedicated professionals that continue to help care for COVID as well as non-COVID care, but they need relief, and you can help. Please get vaccinated. Getting vaccinated, especially before the holidays, will help minimize exposure by continuing by social distancing and getting tested if you have any symptoms. You certainly don't want to pass them on to your friends and loved ones over the holidays. I can't stress enough, as others have stressed, that masking is the first line defense as well as good hand hygiene to prevent spread of this vaccine or of this pandemic. I'd like to now turn it over to Dr. John Carethers, who will talk about the importance of the vaccines. Thank you.
Thank you, Nancy. I want to reiterate many of the elements that my predecessors have spoken about. As we enter the holiday season, you should get vaccinated. There is no debate, no question. You should get vaccinated. Your kids should get vaccinated. There are at least 3 approved vaccines here in the United States that are safe. There have been breakthrough infections. You may have heard some of those on the news who are vaccinated and end up occasionally in our hospital. And you saw that on the graphic from Dr. Runge. But overwhelmingly, the people who have been vaccinated have other health problems, and you'll see that on the graphic as well. Vaccination is your best protection from getting the disease and certainly staying out of our intensive care units. There's a lot of misinformation out there. It's rampant, and that has led to the death of many people, some of them very famous on the news. I will also put a point in for early in the pandemic, people of color were much more impacted by COVID-19. And at present, people of color are relatively under-vaccinated in our state, and that hesitancy has led to deaths. There is no real rationale for not getting vaccinated. I remind almost everyone I see that who has been through school, they have taken the hepatitis A vaccine, the hepatitis B vaccine, the influenza vaccine, measles, mumps, and rubella vaccine, etc. And several of the COVID-19 vaccines are actually much safer. All these vaccines are safe, but even when you're talking about 1 in a million chance, the chances are even much lower with some of these COVID-19 vaccinations. You may know someone who's had COVID-19 and survived it. That's great, but there's often a variable immune response. They should also get vaccinated as well. The best defense to have a robust immune response and prevent COVID in a person is to get vaccinated. The other aspect of this disease, somewhere around 15 to 20% may have lasting effects after getting infected with COVID. To prevent infection with COVID, you need to get vaccinated. If you get infected with COVID, there are some people who will have long haul COVID in which they have symptoms that could include what some people call fuzzy brain or clouded thinking. Dr. Runge mentioned some heart issues. There could be musculoskeletal issues. There are diabetic issues with in some of these long haul COVID patients. To prevent that, you should get vaccinated. Vaccination will help you prevent from coming to our hospital, where you heard that we are extremely crowded, and help you prevent from getting into our ICUs, which are also extremely crowded at this time. Vaccines, if you are unvaccinated, you have about a 5.8-fold risk for testing positive for COVID-19 and a 14-fold risk of dying. So vaccination will help you prevent that. While it is impossible to predict who will have a severe case, as mentioned in our hospital, we have seen younger healthy people die in those cases, but those people were not vaccinated. The biggest predictor for you for not being in our hospital or not getting to our ICU is that you should get vaccinated. I would just close by saying that we want you to be careful. If you're gathering with your family during this holiday season, you should ask your family and friends if they've been vaccinated. And if they haven't, they should wear a mask as our first line of protection. We urge you to get vaccination now. We're in early mid-December, and even one dose can offer some protection. So we urge that now. And if you are sick or have symptoms that might be of COVID, you should not gather. I will now turn it over to Ms. Madison.
Thank you, Dr. Carethers. Okay, I've got some questions that have come in, and I'm going to go ahead and read them and direct them to the right people on the screen. We do have a couple of people on the call who weren't speaking, but I will introduce them to you and give you their names and titles before we send them a question. So the first question is, do we think the surge is a result of Thanksgiving gatherings? And are we concerned about the upcoming holidays?
We're here.
So
Yeah, okay, I'm sorry. Let's send that to Dr. Miller. Again, is the surge a result of what we're seeing from Thanksgiving gatherings? And are we concerned about Christmas and other holiday gatherings causing an even worse surge?
Thank you, Mary. And I'll ask Dr. Washer to also offer a perspective on this. I think the reality is the current surge with the Delta variant has actually been ongoing for many months now. It really started and was evident both in the community and clinically as early as August, and now has been extending through several months with an accelerated impact over the last several weeks. Without question, circumstances that lead to large gatherings, particularly in the absence of the best possible public health measures, increase risk of transmissibility. And that includes individuals involved who are not vaccinated. So this Thanksgiving holiday may be reflected in some of the increasing hospitalizations we've seen even this week, but it's beyond only the impact of the Thanksgiving holiday. And we do look ahead toward the next set of holidays with caution. and want to make sure that we're sharing very clear messages about the importance of public health measures and vaccination. And I would like to introduce Dr. Laraine Washer, who is a faculty member in the Department of Medicine and Infectious Diseases, and also the hospital epidemiologist for Michigan Medicine, who's provided extraordinary and courageous guidance and care throughout the pandemic, to also comment on this question. Dr. Washer?
Great. Thank you, Dr. Miller. Yeah, I agree with everything that you've said. We've been battling this surge way back from the end of August up till now. And I think that really what we're seeing is the result of incomplete utilization of the tools that we have to combat transmission of this disease. And that includes vaccination. The vaccination across the state of Michigan is too low. And it's too low, particularly in those younger age groups. That's one thing that is contributing. Number two, certainly we're spending more time indoors, and that may be with holiday gatherings. And I'll say that large gatherings are a problem, but small gatherings are a problem too if it's among unvaccinated people who aren't wearing masks in an indoor space where there's not good ventilation. And so I think that we're seeing that contributing as well, so both small and large gatherings. And then, unfortunately, the way that infections transmit, the more infections you have in a community, the more likely you will have an opportunity to transmit that infection. And so you start to see exponential growth. So what we need to do now is to reinvest and reinvigorate using the tools that we know work: vaccination, wearing our masks, especially when indoors, getting tested early. And if you develop symptoms of COVID, potential symptoms of COVID, whether you're vaccinated or not vaccinated, and staying home or not around other people when we're sick until we have those COVID test results back. And if we're COVID positive, we need to isolate ourselves for a period of 10 days or more, depending upon the circumstances.
Thank you, Dr. Washer. And we have several questions around the rate of employee vaccination and the pause on mandating for our union employees. And I'd like to turn that to Dr. Runge. Can you talk about how many of our employees are vaccinated, how many of our nurses are vaccinated, and where we stand on mandate?
Thank you, Mary. And I also will end up asking Dr. Washer to comment on this. Currently, 92% of our employees are fully vaccinated, but that doesn't include union employees who aren't subject to the mandates. And I'll come back to the mandates in just a moment. Although our nurses are not required, for example, one of our larger bargain for group, not required to report their vaccination status, about 83% have reported that they are indeed vaccinated. I want to make a comment or two about the mandates. So as you know, I'm sure there were 3 different mandates, federal mandates, one from OSHA, one from CMS, and the executive order. On Monday afternoon, on Tuesday afternoon, a U.S. District Court judge issued a nationwide injunction prohibiting enforcement of the executive order, and that then effectively struck down all the 3 of the federal mandates, which were the justification for required vaccination of all employees of an entity that receives federal funds, which of course all hospitals do. So that's the reason that we have paused vaccination. I think Dr. Washer can also provide additional information, including we did have underway a vaccination program that was mandated for a period of time. And if Dr. Washer may know roughly the number of people that were vaccinated during that period of time.
Yeah, we certainly did see an increased number of vaccinated employees who responded to the mandate during the time when it was enforced. And so I think that, that's heartening to those of us who want to ensure that anybody who is eligible for vaccination is vaccinated. And we still encourage, highly encourage all of our employees, our patients to be vaccinated. I'll add also that we do have an added layer of protection for individuals who are not a part of our bargain for workforce, who are unable to get a vaccine because they've been granted a medical or religious exemption. They are required to be tested weekly for COVID testing if they're asymptomatic. And of course, if they're symptomatic, they would be tested as all of our employees are asked to be.
Thank you, Dr. Washer. Nancy, is there anything that you would like to say?
Thank you, Mary. The only thing I think I might want to add to Dr. Runge's comment is that there actually may be higher than 83% of our nurses vaccinated, as they didn't actually have to report until a date of December 5th or 6th. And the federal mandate actually came into being before that date. And so we all know that there are some employees that were holding out to see how, if anything would happen at a federal level. We do feel, though, that many of our nurses may be higher than 83%.
Thank you very much. I have a question from Dustin at Cranes. How many beds do we have currently closed? And can we give any idea of how many jobs are currently unfilled? I think he's referring to our problems with staff shortages. Dr. Miller, can you answer that?
Sure, I can start, and I will also ask if Tony Denton, our Chief Operating Officer, could also respond to this question. In terms of bed closures, the number is very small. I can't give a specific number today, but it's small, and any closures of beds in the organization are considered very, very carefully, knowing the impact on access. The closures that we have currently are in our pediatric critical care units. It's a small number, and it relates to availability of staffing to ensure that we're able to maintain safe staffing levels for the highest quality of care. From a staffing perspective, there's significant variation across different areas of the organization. We are undertaking measures across the organization from the perspective of recruitment, retention, engagement of our incredible team members to address those issues, to ensure that our staffing levels are always at a safe level, and that our team members are being recognized for the extraordinary care that they're providing. So, Tony, do you have any other comments that you'd like to make on that question?
Excuse me. Yes, we're at about between 300 and 400 open posted positions across the organization. We have scattered openings that are impactful in some areas more than others. But as Dr. Miller noted, we're evaluating every day where these openings occur in order to ensure that the care we're providing is safe. So in addition to the active recruiting, we do an evaluation each day as part of our safety huddle process in order to ensure that we are ready to take care of all the patients that we see each day.
Thank you, Tony. The next question I would like to direct to Dr. Brad Uren, who is an emergency room physician here at Michigan Medicine. The question is, what does it look like on your hospital floors right now? How crowded is this, and how does it compare to other surges?
Thank you for the question. This surge is different for a few critical reasons. One has been widely reported. We're seeing more COVID patients in Michigan hospitals than we've seen at any other time during the pandemic. The other is the more sustained nature of this. This has been building over a period of weeks and months. And while we've had surges and spikes and busy periods even before the pandemic, this has really been a long, sustained battle. And that's starting to show on the faces of my colleagues. And the other thing that's really different here is that we're fighting misinformation among everything else. In the midst of trying to provide this care, not just for COVID patients, but for all of the critically ill patients that are coming to our hospital from around the state to get care, we're also battling misinformation about vaccines and about the treatments available. And so staff are actually having that discussion as well, in addition to all the challenges related to care. And I think that's why you're hearing so many of us, asking for help today, asking for people to get vaccinated and to play their part so we can preserve this healthcare system and the access across the state for everyone, so that we can continue to do the job that we all chose.
Mary, if it's okay, could I ask, thank you, Dr. Uren, could I ask Dr. Carethers to also comment on that? With Dr. Carethers' leadership, our internal medicine teams have been taking care of inpatients now for 21 months, including through the 4 months of the last resurgence. And I think the question about what it looks like in our hospitals from Dr. Uren's perspective in the emergency department, Dr. Carethers' perspective in the inpatient unit, and for Nancy May, for our nursing teams and all of our team members, I think is a really important perspective to share. Dr. Carethers?
Thank you, Dr. Miller. I think as a preface, as Dr. Miller said, since the pandemic began, the Department of Internal Medicine, largely through our hospitalists, our infectious disease, our pulmonary and critical care, and others, have really been the front bearers for the care of these patients, along with our nurses. As Dr. Uren mentioned, this surge is a little bit different from the previous. This is the fourth surge. The first surge was kind of an unknown, uncharted territory, where it was all hands on deck, and as many institutions closed down their ambulatory care operations in order to try to affect care, and we had no treatments, no vaccine or anything. And then the two intervening surges, surge 2 and surge 3, were more almost classic Gaussian spikes, where they rise, spike, and then come down. And so over maybe a 4-6 week period, we'd have a crunch time, and then things would be relieved. This surge is a little different. So first, this is the fourth surge, and you know that that's worn on our staff and our physicians for the repetitive nature of care for these types of patients, when much of this can be avoided, particularly with vaccination and other protections. This surge, as Dr. Miller said, started in August, and it's been just slowly building. And then I would say over the last 2 to 3 weeks have begun to spike on top of that high base line of cases. I'm not sure exactly why it's structured this way versus the last 2 surges, other than the pattern seems to be March, April of each year and November of each year, where we tend to spike in the state of Michigan. On our floors are full and busy. Working with the hospital, as Dr. Miller said, there's been surgeries canceled to make way for medical beds, largely for the COVID surge, which has stretched our physicians, our caregivers, to care for those patients. On a typical, I'll say, non-COVID surge, our physicians in internal medicine probably care for somewhere around 280, 290 beds, but instead we're caring for maybe 340, 350 beds on average, which we were not structured to do. So there's stretching of the staff, the physicians to care for. Now we are doing it in a safe manner. We're pulling people are doing additional shifts, stretching their time to do that, to care for these patients. So they are getting safe care, but it is over time with the fourth surge putting some strain and causing some fatigue of our healthcare workers in that regard.
Thank you, Dr. Carethers. I have a couple questions about monoclonal antibody infusion treatment. The first one is this a good alternative to help keep Michigan's numbers down? Or would it be better to have people get the vaccine, which will last longer and be more effective? Laraine, I think this would be a good one for you to address.
Yeah, thank you for the question. I think while monoclonal antibodies against COVID are valuable tools for treatment and also for prevention after exposure in some cases, they are not a substitute for vaccination. There's a few reasons for that. One is that there are different types of monoclonal antibodies, and we've seen specific types of monoclonal antibodies become less effective against a new strain or a new variant. And that may be the case with the Omicron variant, which we're anticipating may spread to the United States more fully. Secondly, they're not 100% effective at preventing severe disease or preventing mild disease from becoming severe disease. So really, they should be reserved for people who are immunocompromised, who happen to get COVID, even if they're vaccinated, or those who are elderly and have other risk factors. And so, well, I think they're really important tools, and we can certainly utilize them even more fully than we're doing now. They're absolutely not a substitute for vaccination. And then I'll also add that the effect of a monoclonal antibody is limited. Likely that monoclonal antibody declines from the system over a period of several months. And so it will not provide protection for the duration of the pandemic.
Thank you. And another question about this is, can we give an estimate of how many monoclonal antibody therapies we are doing every day or every week? Maybe Dr. Miller, do you have an estimate for that?
Mary, I don't have a specific estimate to share right now, but I do know that we've had concerted efforts in the past several weeks and currently to support staffing for this critical therapy and to continue to maintain access. So we can follow up with a specific estimate. Thank you.
Thanks. I will remind our media attendees that you can type in a question. We're getting close to 12:30, which is when we're going to stop. I have one more that I want to ask. This is from John King at WHMI. What would you say to school boards that have resisted implementing mask mandates and are eliminating quarantines for students who are asymptomatic? Dr. Washer, would you like to take that one on?
Sure. So, I mean, I think I would say to school boards and the parents who are trying to influence those school boards that wearing masks in schools is really a public health imperative. It's not really a decision or an opinion or a political stance. It's a public health imperative for which, you know, it's one of the tools that we have, and it's a very low-tech tool, and it's very effective. And it will keep children safer. It will keep the community safer. It will keep the numbers of COVID infections down, which will result in lower numbers of people coming into our hospitals and resolve some of the strain that we're seeing here in our health system.
Mary, may I add a comment?
Absolutely.
Yeah, the asymptomatic spread occurs. And we learned this through some of the early studies from the nursing home from the Seattle area when the outbreak occurred, that many of the patients who ultimately got COVID did not have symptoms, sometimes as long as 3, 4, 5 days after testing positive. They looked at samples before they even got symptoms. And so there is true asymptomatic spread. The thing that we understand, even in children, even though children as a whole don't get as sick as adults as a whole, they can still spread the virus. And keep in mind, children are exposed to teachers, janitors, parents in these schools and at home. So I'm with Dr. Washer. This is not a political statement. It's a public health statement based on the science at hand.
Great, thank you very much. One other question, I think this one can go to Dr. Miller. How long do you think the limitations on surgeries and transfers will last? And you mentioned 40 surgeries being canceled. What time period was that?
Thanks for the question. So the 40 I mentioned was just in this week already alone. The duration with which we'll be reducing scheduled clinical activity is really difficult to predict. In fact, we've been operating below our pre-COVID activity for surgical care for several months now during the Delta surge, although that has accelerated in the last several weeks. The decisions will be totally dependent on the COVID-19 patient census. So we will need to see a significant decrease in those numbers before we would return to our normal operations.
Okay, thank you. I don't see any other questions. And I'll give everybody a couple seconds if they want to type one in really quick. But I think I'll ask Dr. Runge if there's anything that you would like to add.
Thank you, Mary. And again, thank all of you for attending today. And I'd like to thank our experts who are on the phone call, on the Zoom call. You've heard from all of us. Please help us help our communities and everyone in them get vaccinated. That's our plea to you. It can help in so many ways, and you heard that from so many people. Please encourage and help people who are ill, as described by Dr. Miller and Dr. Uren. They need to come to the emergency room. Others, there are many ways to get care, from virtual visits to calls to their healthcare provider. So try that first if they're not as ill as may be necessary to come to the emergency room. But mainly, please help us get everyone get vaccinated.
Thank you again to the media. Again, if you have follow-up questions, you can always email me, email Noah Fromson, who sent you the press release, and we'll be happy to follow up on any other outstanding questions. Thank you all for attending, and have a great afternoon.